Hi guys, this is Cristian from ArtSmiles. So today we have another surgery. We have 3 implants to do, and I'm going to show you what we have planned and what we're going to do. So this case here is a bit more complex, and I'm going to show you the easiest one, from the easiest to the most complex implant to do. This is how we do the planning. As you can see here, this is the patient, all the planning that we do. And we use surgical guides to do the implants. Most of my surgeries, I prefer using surgical guides because makes the procedure much more accurate, more reliable, and safer for the patient. All right. So starting from the molar, this is the first one I'm going to show you. This case here. It's more straightforward. As you can see here, we have plenty of bone around the implant. Just for you to understand this, here you can see the implant. There is a line around the implant. This is what I call safety line. We need to check if there is if the safety line is not contacting the other teeth or the structures that could cause a damage if we place the implants there. So this implant here, in this area, it's a posterior area. It's more in the back. Sometimes, in some cases, when we are doing a surgical, a fully guided surgery or a guided surgery, sometimes if the patient doesn't open the mouth enough, it's more difficult to reach that areas. But either way, I always try to start with this with the guide. If it's not possible, we go freehand. In this case, we have planned to do just a pilot drill guided, because as you can see here, the patient has a very limited space to place the implant. So we're going to do we're going to place the implant there. We're going to do just the pilot drill. It's the first drill, and then the other drills I'm going to do freehand. Okay, this is the easiest implant that we're going to do today, and then we're going to move on to this one. This is the canine left side. So this tooth here, as you can see, this is the cheek. This area here is the cheek of the patient, and when I place the implant, the idea is to have at least 2 millimeters of bone in the front, because if you don't have enough bone, the metal, the titanium of the implant shows off when you smile, and gives a very dark area in the gum. It's not beautiful. And also this is to preserve in the long term, to have health in the implant in the long term. So this implant is a bit more complex than the other one. We need to open a little bit of a flap, open a little bit the gum, and then we do bone graft and the implant at the same time. Okay, so this is the second implant. The third implant, this is what we call immediate implant. The patient has the tooth is still there, but there is no, we can't use the tooth again to put a crown. So we need to take it out. We're going to do an implant. It's called an immediate implant. We remove the tooth at the same time we place the implant. I'm going to do bone graft and close everything, and then after that I'm going to do a provisional in that area. So for the whole surgery, we're going to take about 3 hours. And if the patient allows us to record the surgery, and then I'm going to share with you. Okay, thank you very much.